A lot of people are not too familiar with hospice care and all the benefits that it does have to offer. Hospice care comes into play when patients do spend an extreme amount of time going in and out of hospitals and they don't want to seek any more aggressive type of treatment.
It's all about treating symptoms and comfort management. It's not about treating anything aggressively, but through symptom management and comfort care, patients can thrive in the comfort of their own homes or care facilities surrounded by their families.
Typically, this is an admitting doctor or their community physician that is the one that's going to be suggesting or giving that option for hospice.
There's a lot of misconceptions regarding hospice and who qualifies. A lot of people feel that only their loved ones qualify if they are in their last moments, hours, days, and weeks of life. But unfortunately, that's not always necessarily true. Those that qualify for hospice are the ones that do have a life-limiting illness.
And that's something like cancer, in some cases dementia, in some cases heart failure, kidney disease. There's an array of them that is qualified as under a hospice. It's just depending on each patient. It's all individualized and each case is different.
Hospice care is generally paid through Medicare. Medicare covers hospice care 100%. Medicaid also does cover hospice care as well.
All medications and equipment and transport, nursing care, physicians, all of that is covered 100%. It's the only benefit through Medicare that's covered at 100% through the life of the patient.
And there are some private insurances as well that do cover some hospice care, but the main payer for hospice is Medicare. Hospice does provide a lot of resources for patients and their families to help them through a hard time that they didn't know how they would get through without receiving these services.
They are provided with the highest level of medical care, and that includes routine visits from doctors, the nurses, the aides, the chaplains, and the social workers.
They do a comprehensive head-to-toe assessment every time they come. They make sure all medications are good and patient has no new issues, infections, pain. They're there just mainly to make sure that the patient is stable and comfortable.
Nursing services consist of a minimum of one visit a week with a maximum of daily visits, depending on every patient is different and what their needs are. We also do have 24-hour nursing services available for any emergencies. We also have our CNAs, which are certified nursing assistants that help assist families with showers, baths, changing sheets.
Hospice care also covers all medications associated with the diagnosis, anything that has to do with pain management, symptom control. That can be, medications for pain, infection. We cover all medical equipment. So if you need a hospital bed, overbed tray table, oxygen, all those things are covered at 100%. If a patient's in the hospital needing to have transport from the hospital to home or care home or wherever they're going, transport's covered 100% as well, and it's a medical transport, so if a patient needs oxygen during that transport, it's provided.
And we also provide any kind of incontinence supplies that's necessary for that patient, whether it's wipes, whether it's diapers, any kind of tools necessary to make sure that patient is comfortable.
We also do have our medical social worker that helps assist families with anything that they may need. Sometimes they just need forms signed by a physician. They need paperwork filled out for work to get time off.
We also provide a spiritual counselor who's also known as chaplain, and they can range from someone that's a pastor, someone that's non-denominational, being there to speak with the patient, to speak with the families, and they're just there for emotional comfort. A patient can remain on hospice care indefinitely. There's a caveat to that. In Medicare's definition, it's a patient with a life-limiting illness of 6 months or less if the disease were to run its normal course. However, some patients, when given the right care and all medications are given correctly, their symptoms are treated, and in the comforts of their own home, they can remain stable for a lot longer.
Sometimes I've had patients on hospice anywhere from a couple of hours up to even possibly 2 years. It all depends on how they're doing, and as long as they remain hospice appropriate, they may stay on and receive those hospice benefits.
The first 2 benefits are 90 days each, so that comprises the first 6 months. After that, Each benefit is 60 days. And a physician needs to certify by a face-to-face visit stating that the patient still qualifies for service.
Sometimes the patient might get better, or sometimes what they call graduate from hospice, and that moment be able to get discharged and go back to your primary care physician, where you don't need all the social workers, the volunteers, the chaplain services, etc.
There are a number of reasons why patients are discharged from hospice care. Number one, they can be discharged because they no longer qualify for hospice. They've gotten better, and we can no longer prove decline. And if we can't prove decline, then, by Medicare's definition, then they will no longer cover the patient. So that's one way we discharge patients, and it's called a life discharge. Number two, a patient can be discharged through revocation, meaning there's no obligation to stay on hospice care services. Patients and families think once they sign on to hospice that this is it, that life is over. Patient's gonna sign on and pass away on service, and that's not necessarily true.
Check out ZNest's entire library of informative videos on senior care.